So next we're going to manual muscle test the Palmar Interossei. And again, with Palmar Interossei, think of it as PAD, P-A-D. So we're going to be able to test the adductors. So with that, we're going to be able to, with the fingers adducted, going to try to abduct each finger away from the middle finger. So I'm pulling, 2, 3, and the small finger, 1, 2, 3, and relax. Then with the dorsal interossei, you have 4. And the dorsal are going to be for abducting. So we're going to have the patient spread their fingers apart. Again, 4 of them, but we're still looking at these 3 fingers because the middle finger has 2. So what we're going to do is with the fingers abducted, I'm going to try to press the index finger towards the middle finger. 1, 2, 3. I can do the same with the ring finger. 1, 2, 3. And for the middle finger, I can be able to go both ways. 1, 2, 3, and 1, 2, 3. Relax. Now we're going to look at the Flexor Pollicis Brevis. For the Flexor Pollicis Brevis, we have flexion of the MCP joint with that muscle. So what I'm going to do is have the patient flex their MCP joint of their thumb, but yet keep the tip of their thumb extended so that the FPL doesn't come in and try to cheat. So with the thumb tip extended, the MCP joint is flexed. I'm going to come into the base of the proximal phalanx of the thumb and try to extend that MCP joint while they try to resist. 2, 3, relax. Then we have our abductor pollicis brevis. So with the longest, we tested in a radial position of the thumb. This one, we're going to have her in more of a palmar abducted position with pressure on the metacarpal trying to adduct the thumb. 1, 2, 3, relax. Then for the adductor of the pollicis, adductor pollicis, I'm going to have the patient bring their thumb into their palm, not full opposition, but stick their thumb right at the base of their third metacarpal. And I'm going to try to come in and be able to try to bring their thumb out of their palm, and I'm going to have them try to hold it in there. So I'm going to try to pull up. 1, 2, 3, relax. Then we're now going to have the patient bring their thumb all the way across to oppose their small finger. Okay, so with that being said, you also have your opponent's digit minimi that is engaged as well to bring these 2 fingers together. So I can test both out by getting into the base of the proximal phalanx for both the thumb, and then also at the base of the small finger, and be able to try to pull apart. 1, 2, 3, and relax. So I can get a gauge of both the opponent's pollicis as well as the opponent's digit minimi. Finally, you have a couple more for the small finger. You have your flexor digit minimi, where I'm going to have the patient flex their small finger up and into their hand to where I pull back on the base of that proximal phalanx. I'm going to try to pull back. 1, 2, 3, relax. Again, for the flexor digit minimi, that is different than trying to test the flexor digitorum superficialis, where I'm pulling just past the PIP joint, or the profundus when I'm pulling at the tip. Finally, the abductor digit minimi, I'm going to have the patient bring their small finger into abduction. I'm going to place my pressure at the proximal phalanx as I try to adduct the finger. 1, 2, 3, and relax.